guys, you're welcome to the Dssg Nation. So if this is your first time watching a video from the Dssg Nation, do make sure you subscribe and hit the bell button so we can notify you whenever we create a video. So today we are going to be talking about the cardiac failure. So pick your paper and your pen and let's get started. Hi guys. Yeah, welcome back. So we said we are going to be talking about cardiac failure. Cardiac failure. Now, the word cardiac is denoting the heart, the organ heart. While the word failure means inability to perform function. Inability to perform a function. So when you say cardiac failure, it simply means the inability of the heart to perform its function. And what is the function of that heart? The function of the heart is to beat and pump blood to all the body organs. To all the body organs. So that is the function of the heart. The heart should pump blood to meet the body needs. So, but in heart failure, the heart is unable to do this work, is unable to perform this function. So it is just the inability of the heart to pump blood to meet the body needs. So what are the causes of cardiac failure? Causes. So what are those things that can lead to the inability of the heart to beat and pump blood to meet the body needs? So what are the causes? So the causes include angina pectoris. Angina pectoris. We've talked about the pathophysiology of angina pectoris. If you know nothing about it, I'm going to drop a link ahead there. Just make sure you check it after the video. So another one is myocardial infarction. Myocardial infarction. Myocardial infarction. So we've talked about it as well. So another one is coronary heart disease. Coronary heart disease. So any disorder of the coronary artery that can lead to occlusion of the coronary artery and prevent blood supply to the heart. So we have other causes apart from this, but these are the major causes. So let's talk about the pathophysiology of cardiac failure now. But before I proceed to that, I would like to give just a quick recap on the heart so you can really flow along with this pathophysiology. So stay tuned. You are welcome back. So we said we are going to be talking about the pathophysiology next. Pathophysiology. So, recall from our video on angina pectoris. So I said whenever I want to talk about pathophysiology, you give me the definition first, and then you list the causes in a sentence, and then you are going to pick a cause, or you pick all the causes. That regardless of the cause of the disease condition, it's going to follow the same pattern. Then you start writing your pathophysiology, how the cause leads to the cause. So now, let's say I want to pick MI, myocardial infarction, as the cause of angina, the cause of heart failure. So how am I going to trace that? So from the knowledge about myocardial infarction, I'm not going to be wasting our time. We all know that myocardial infarction is going to lead to what? It's going to lead to the death of the cells of what? The death of the cells of the mausoleum of the heart. So the cells are going to be dead and they are not going to be able to pump the blood effectively anymore. So I'm going to start from there. But first, let's come in with the diagram of the heart to understand this. So to draw your heart, you come in with your end first. So I believe by now everyone should be able to draw the organ heart. So then it turns into a love shape. So same thing for the other side. We only need the distal aspect. So let's just move like this. So you come in with your barbs, you stop. So you come in a line, broad out a little bit. So same thing for the other side. Outward, stop. So same thing. So now we know that this is the organ heart. And it has some kind of blood vessels associating it with it. So we have the superior vena cava, we have the inferior vena cava. So we have the pulmonary artery right here, the pulmonary artery. So the pulmonary artery. So after then we have the aorta. But here we don't really need to talk about the aorta, so we can just leave it for now. In the next diagram I'm going to be talking about it. So then we have our pulmonary veins. Pulmonary veins. The pulmonary veins. So now We know that the way the heart pumps the blood to the body system, so the blood is going to enter through the inferior vena cava and the superior vena cava, and then it's going to enter into the right atrium, and from the right atrium it is going to be pumped into the what? Into the right ventricle below, and from the right ventricle it is going to be pumped into what? Into the pulmonary circulation. So after that, it's going to move to the what next? It's going to move to the lungs. So the lungs, here's the lung here. So same thing with the other side, the blood is going to go into the lungs for oxygenation, to receive oxygen, the lung. So after the blood reaches the lung, it is going to turn back oxygenated and then come into the pulmonary vein. And the pulmonary vein is going to empty it into the what? Into the left atrium. So same thing with this one as well. So the oxygenated blood is going to turn back into the heart. So it's going to empty into the left atrium. So after that, the blood is going to come into the what? Into the left ventricle. And from there, the left ventricle is going to pump it into the aorta. And that is how the body is being supplied to systemic circulation. But in cardiac failure, what is to happen? So I'm going to clean this and come with the pathophysiology now. If you know nothing about the organ heart, just go and watch our video on the heart. Well, I'm going to drop a link ahead so you can check it after this very video. So let me clean this and come with the cardiac failure now. Yeah, so right now, what's going to happen in the pathophysiology of cardiac failure? Now, let me come back with the diagram of the heart now. So you're in, then it's a love shape. So you line it, stop, you line it broader a little bit. So same thing to the other side. Yeah. So we have your superior vena cava right here. You have the inferior vena cava right here. So these are the openings. So you have a pulmonary artery. So going to the lungs. So going to the lungs. Then you have two veins coming from it. So the right and the left pulmonary veins, and they are going to enter into the left atrium. So, okay, let's talk about the aorta as well. So the aorta. So your arc. So it comes downward. Now, in cardiac failure, we said the heart is unable to pump the blood. So since the heart has failed, the muscle cells has failed to do what? To pump the blood into the systemic circulation. So what's going to happen? There will be backflow of the blood. So naturally, the left side of the heart, the left ventricle, is the one pumping blood to meet the body needs. So the blood inside this place is going to be static. And then with time, it's going to be filling, and then it will regurgitate. Regurgitation means backflow. So it is going to flow back into the what? Into the left atrium. And from there, it's going to pass through the pulmonary veins. So, and it's going to reflux back into the lungs. It is going to regurgitate back into the lungs. So, and when this blood, when it flows back into the lungs, it is going to cause what we call pulmonary congestion. Pulmonary congestion. Pulmonary congestion. So, and later the pulmonary congestion will lead to pulmonary edema. So, and the edema is going to impede respiration, like it can lead to dyspnea, difficulty in breathing, dyspnea. So, your pulmonary edema is a sign and symptom, your dyspnea as well is a sign and symptom. So, if you really want to be talking really deep, we'll be talking about since this edema has occurred within the two lungs, so the next thing that's going to happen is that there will be no exchange, there will be no adequate exchange of oxygen and CO2. So the person can develop cyanosis, like bluish discoloration of mucous membrane and the skin generally. So that can also be a sign and symptom for what? For cardiac failure. So when all this blood, when they are regurgitated into the lungs, so they will still continue their way into the what? Into the pulmonary artery. So the blood is going to come back into the what? Into the pulmonary artery and then downwards. So same thing happens here as well. So same thing happens here. Same thing happens here. So into the lungs, then into the pulmonary artery, and then back into the right side of the heart. So the blood is going to come back into the right ventricle. And when it comes back into the right ventricle, what's going to happen? It is going to be static within this region as well until this is full. And when it is full, it is going to regurgitate again. So the backflow will occur, is going to go into the right atrium. And from there, it has two ways to pass. It's either it goes into the superior vena cava or it comes down into the inferior vena cava. It is going to go back into those two vessels actually. But let's talk about the superior vena cava first. So the backflow of blood into the superior vena cava is going to bring about edema of the upper part of the body. Example is the skull. So the edema of the brain is going to cause what we call cerebral edema. Cerebral edema. So that can be a sign and symptom. And if you really want to dig deep into cerebral edema, it is going to cause what we call increased ICP, increased intracranial pressure. So, but we don't want to be talking about that now. That will be a complication like that. So, and this cerebral edema will increase the pressure on the cerebrum. It can lead to headache, confusion, lethargy, and the likes. So all those things are signs and symptoms. So, and this place, it is going to go into the neck veins. So the superior vena cava, the neck veins are emptied into it. Because the blood is going back, it is flowing back. It is going to do what? It is going to cause distended neck veins for the patient. So, and that is for the superior vena cava. So for the inferior vena cava, what's going to happen? I would like to clean the blood and come back with it. But let me just quickly give you a quick recap. So in congestive cardiac failure, so what's going to happen is that the heart is going to fail to pump the blood to meet the body needs. And then the blood is going to flow back into the left atrium, and from there into the pulmonary veins, from the pulmonary veins into the lungs, and from the lungs into the pulmonary artery. But within the lungs, it's going to lead to manifestation of signs and symptoms, such as the pulmonary edema, dyspnea, cyanosis, because there is going to be a reduction in the exchange of oxygen and CO2, and there is even a risk for acidosis, because there will be difficulty for CO2 to move out. So let's talk about that under fluids and electrolyte imbalance, not now. So after then, the blood is going to come into the pulmonary artery, and from there it's going to run down to the right side of the heart. And when it comes down to the right side of the heart, it's going to be static within it as well, and the right side of the heart will also fail. So it means the left side of the heart leads to the right side failure as well. The left cardiac failure leads to the right cardiac failure. So what happens next is that the blood is going to flow back into the right atrium, and from there it's going to go into the superior vena cava and the inferior vena cava. So going to the superior vena cava, this is going to cause distended neck veins, and it's going to affect the upper part of the body as well. Edema is going to occur. An example is the cerebral edema, which can also cause headache, lethargy, confusion, and the like. So talking about complication is going to lead to what we call increased intracranial pressure. So we said I'm not going into that today. So let's talk about the inferior vena cava now. So the inferior vena cava, if the blood flows down into the inferior vena cava, what is going to happen? Stay tuned. Yeah, welcome back. So we were discussing the pathophysiology of cardiac failure. So we draw the organ heart, and we were using it to explain the cardiac failure. So without wasting our time, let's just talk about the right side. So we said the right side, so after the regurgitation of blood, is going to go to the superior vena cava, and it's going to lead to signs and symptoms such as distended neck vein, cerebral edema, headache, and the likes. So, but what if the blood flows into the inferior vena cava? Anatomically, the inferior vena cava is connected with the hepatic vein. So the hepatic vein, and that hepatic vein is the vein that drains blood away from the liver. Is the vein that drains blood away from the liver. So which means the fluid, the blood rather, is going to move from the inferior vena cava into the hepatic vein, and from the hepatic vein down into the liver. So you have the regurgitation of fluid into the liver, and that is going to bring about edema at the right upper quadrant. Like your liver is just located at this side. So due to the accumulation of blood within it, it is going to lead to a slight increase rather at the right upper quadrant, and it's going to be associated with pain. So there can be a kind of pain at the right upper quadrant because of this accumulation of blood within the liver. So and after then, the liver is connected to what we call the portal vein. The portal vein. So the portal vein carries the blood with nutrients that come from the intestine. So it takes it to the liver. But now there is backflow, so the blood also have to go back to where they are coming from, such as the intestines, and that is going to irritate the GIT. And when it irritates the GIT, it's going to lead to signs and symptoms from the GIT, such as nausea and vomiting. So that will happen. So we all know that the membrane that is covering the abdominal organ is called the peritoneum. So accumulation of fluid within the peritoneum, is what we call ascites. So it will make the person have kind of large abdomen. So that is ascites. So and due to this widespread stasis of blood within the blood vessels, this is going to lead to edema of different body parts. So if this person with heart failure is sitting down, the person can have the sacral edema. So the sacral edema can be evident. You can see them. They are thought to be big due to the edema of different body regions. But when they stand up, the edema and the fluid is going to shift to the leg, and that will cause pedal edema. So pedal edema. So that is going to lead to pedal edema. So, and that is that for the second phase of the pathophysiology. So a quick recap, I said in heart failure, the blood is going to be flowing back to where they are coming from. So, like the blood will move from the left ventricle into the left atrium, and from there to the pulmonary veins, from the pulmonary veins into the lungs, where it is going to lead to signs and symptoms such as pulmonary congestion, pulmonary edema, dyspnea, orthopnea to be precise, a kind of respiratory distress that is relieved by sitting up. So, like after that, due to the impedance in oxygen and CO2 exchange, that is going to lead to cyanosis, the blue discoloration of the skin and the mucous membrane. So after that, you said the blood is going to go into the pulmonary artery, and from there it is going to be congested into the right side of the heart, and that is going to reflux back into the what? Into the right atrium, and then from the right atrium into the superior vena cava, which can lead to distended neck veins, cerebral edema, headache, confusion, lethargy, and the likes. So we said it can come down, and then it's going to be the blood is going to flow into the inferior vena cava, and from there it is going to go into the hepatic vein and then to the liver. And the accumulation of this blood within the liver is going to lead to escape of this fluid within the liver, and it's going to lead by the enlargement of the liver. So and that can be felt on the person's right upper chondral region. So and after then, we said the blood is going to go into the what? It's going to go into the portal vein, which has a connection with the abdominal organs, the GIT organs to be precise, and that is going to lead to things like nausea and vomiting. So we said accumulation of fluid into the peritoneum is ascites, and accumulation of fluid to the sacral part is called the sacral edema. So the person on standing will have the pedal edema and the likes. So now, when all these things are happening, the body will think of a way to reverse it. So using the compensatory mechanism, our knowledge of homeostasis. So what is going to happen? In what way can the body compensate for all these things? And that will lead us to the last phase of the cardiac failure, the heart failure, the pathophysiology of heart failure, rather. Just stay tuned. Yeah, welcome back. So we said we are going to be talking about the compensatory mechanism. When all these things, all these negative effects of the heart failure is disturbing the body system. So what's going to happen next? Due to the fact that the blood going into the aorta is very little in volume and pressure, so reduced blood volume is going to reach the kidney, or the blood that is low in pressure. The blood that is low in pressure is going to reach the kidney, and the kidney is going to trigger or initiate a mechanism called the RAS. So a video has already been dropped on the renin angiotensin aldosterone system. So make sure you watch it. So after watching it, you're going to understand every little bit of what I'm talking about right here. So what's going to happen when there is reduced blood pressure and reduced blood flow to the kidney? It is going to lead to the production of renin. So renin is going to be produced by the granular cells of the juxtaglomerular complex, the JGC. So if you don't know this, don't worry, just go and walk the rats, you understand it. So renin is going to react with what? With an enzyme called angiotensinogen. And this comes from the liver. So the liver is responsible for producing this. So when this renin reacts with angiotensinogen, it's going to form what we call angiotensin 1. And then this angiotensin 1 is going to react with another enzyme called the ACE, angiotensin converting enzyme, from the lungs. And in short, everything is going to lead towards the production of angiotensin 2. And this angiotensin 2 is a potent vasoconstrictor. A potent vasoconstrictor. So it leads to the constriction of vessels. Now just imagine, we said we have the heart right here. So we have the heart right here. The heart right here. So we have the inferior vena cava and we have the superior vena cava here. So if constriction occurs to all these vessels, what's going to happen? Just imagine that the blood within this vessel is at this level, and then this vessel become constricted like this. What will happen to this level? This level is going to rise, so it is going to enhance or promote the supply of blood into the heart again. So when there is widespread vasoconstriction, this is going to increase the venous return. The venous return is just increasing the amount of blood coming back into the heart through the veins. So constriction, the antecedent is going to bring about increased venous return. And when there is increased venous return, the blood is going to be coming back into the heart. And the heart will see a need to pump the blood into the what? Into the systemic circulation, because the venous return is really high due to the constriction of the vessels. So there is high venous return, which means the workload of the heart will have to increase. So the heart will now start beating vigorously and rigorously just to be able to make the body needs and get out all these venous return out of the heart so that it can boost the body system. So when this heart keep beating and increasing its beating, it is going to become weak with time, and the cells of these muscle layers, I mean the cells of the muscles, the cell of the myocardium rather. So the cell of the myocardium are going to become hypertrophied. Hypertrophied. So what's the meaning of that? It's from the word hypertrophy. So hypertrophy is the enlargement of the cell. So because there is constriction due to the presence of angiotensin 2 in the blood, so there is increased venous return. And when there is increased venous return, the heart sees a need to pump the blood out of the heart at all costs. So that's going to increase the activity of the heart, and the cells are going to be tired and they are going to undergo hypertrophy. They are going to become enlarged. They are going to become weak and flabby, and that is going to lead to what we call the cardiomegaly. Cardiomegaly. So the word megaly means enlargement. So when you say cardiomegaly, it means enlargement of the heart. So enlargement of the heart is going to occur, and with time, the heart is going to lose its function. So and that is going to worsen the situation, and it's going to be leading to some complications like cardiac arrest and the likes. And that is the pathophysiology of heart failure. So if I will call this the end of the class, I'm going to come in once again and give us a quick recap on heart failure at large. Yeah, so thanks for staying tuned. So I said in heart failure, what used to happen is that the heart fails to pump the blood to the body system. So and when that happens, regurgitation will set in. So like there'll be backflow of blood from the left ventricle into the left atrium, and from the left atrium it goes into the pulmonary veins and then into the lungs. And within the lungs, it's going to lead to pulmonary congestion and pulmonary edema. And after that, it's going to bring about dyspnea, difficulty in breathing. So orthopnea to be precise, a kind of breathing that is easy when the person is sitting in a sitting position. So and after that, we said it can also lead to the disruption or a disturbance in the exchange of oxygen and CO2, and that can lead to clammy skin, cold clammy skin, like there is cyanosis as well. So and then backflow of blood from the lungs is going to go into the pulmonary artery, and from there it is going to come down into the what? Into the right side of the heart. And when the right side of the heart fails as well, the blood is going to go back into the right atrium, and from there to the superior vena cava. So when it goes into the superior vena cava, there will be distended neck veins as a sign and symptom, and then there will be edema of the part of the body, such as the brain. So and that is called the cerebral edema, and the cerebral edema can also lead to things like headache, confusion, lethargy, and the likes. So we said the complication is going to lead to intracranial pressure, increase intracranial pressure actually. So we said to the inferior vena cava. The inferior vena cava is connected one way or the other to the hepatic vein. So, and the blood is going to go back into the what? Into the liver, and that's going to lead to what? Increase, a kind of elevation, slight elevation at the right upper chondriac region, because the liver is located at the left hypochondriac, extending through the epigastric and terminating at the left hypochondriac. So all these regions is going to be slightly elevated, and it is going to be tender on a patient. So when it is touched, it brings about some kind of slight pain. So and after that, there is going to be reflux of blood or backflow of blood into the portal vein, which has a connection with the abdominal organs, and that is going to lead to nausea and vomiting. So and after that, we talked about accumulation of fluid into the peritoneum. So that will lead to ascites, and due to widespread stasis of blood within the vascular system, this is going to cause edema of different parts. So when the person is sitting, you can just see sacral edema. It is going to be evident. But when the person is standing, the edema is going to shift to the leg, and the person is going to be is going to have a pedal edema rather. So, and after that, we said due to all this failure, what is going to happen? The body will try to trigger a mechanism to normalize the whole situation, unknowingly to the body system that things has really gone out of hand. So it is going to trigger the RAS. But what triggers the RAS in an heart failure? Reduced blood supply to the kidney, and a kind of blood flow within the vessels that has a low pressure. So that is going to lead to this release of renin. And release of renin is going to convert angiotensinogen from the liver into angiotensin 1. And then angiotensin converting enzyme from the lungs and from the distal convoluted tube is going to convert angiotensin 1 into angiotensin 2. And angiotensin 2 is a potent vasoconstrictor, and it is going to bring about a widespread constriction of the blood vessels, and this is going to increase the venous return. And when there is increase in venous return, the heart will see a need to increase its work by pumping vigorously and rigorously just to push out all this fluid within it. So, and that is going to lead to increased activity of the heart, and that is going to lead to enlargement of the cells called hypertrophy. And when these cells are enlarged, they are going to lead to cardiomegaly, which means enlargement of the heart. So cardiomegaly is a complication of heart failure. So after that, the heart is going to be weak, and sometimes it can undergo arrest. And that is that uncongestive cardiac failure. I really thank you that you enjoyed this video. So if you do, just make sure you give it a thumbs up, like the video, and if this is your first time watching a video from Dssg Nation, just do make sure you subscribe and hit the bell button so we can notify you about updates. Hi guys.